most depressing weeks in 7 years as a local councillor. I heard from charities what the cuts programme would mean for them. The Edward Scissorhand approach this council is taking to making cuts to the voluntary sector is going to have a devastating impact on a heroic volunteer army that has helped us all get through this COVID-19 pandemic. But even more tragically, it is going to decimate services for the most vulnerable in the borough. Let me set out some of the impacts the cut programme is going to have. Croydon Disability will have to close. Croydon Carers will close their respite care programme, their learning disability care and support service, and their health and wellbeing service. Croydon Vision staff are facing redundancy, but despite numerous calls and emails to the council, they cannot get anyone to respond to them. Services for over 65s will be dramatically reduced. Woodside bereavement services will have to close. The Croydon Hearing Resource Centre contracts with the council ends on the 31st of March, but no one in Croydon will confirm what will happen after that date. If time allows, I could go on with other examples that I heard last week, but it is very clear that this Labour cuts programme is going to have its biggest impact on the bereaved, people with disabilities and the elderly in Croydon. Last week, CVA, in partnership with 20 leading voluntary sector organisations in Croydon, asked the council to pause the cuts programme and instead sit down with the voluntary sector and work out how the council and the VCS can work together to serve in the future. To give you a practical example, up until recently, I managed Shelston Contact, a neighbourhood care charity that ran support services for older and vulnerable residents living in Shelston. Thanks to my team of over 300 volunteers, we were able to provide a multitude of services on an annual budget of £60,000 per annum, with a grant from the council of just £15,000. I wrote a paper that demonstrated that if the council and NHS were to provide similar services, it would have cost around £250,000 per annum. We all recognise that the council needs to make financial savings, but I urge members this evening to take up CVA's offer and work with the voluntary sector to develop a partnership approach to running services in the future. The approach will produce the long-term savings that this council desperately needs to make. Please pause this scattergun approach to cuts that you have taken and just for a moment think about the devastating effect this is having on Croydon's most vulnerable residents. For all the above reasons, I propose and support the motion this evening. Thank you, Madam Mayor.
Thank you. Councillor Hopkins.